we're sitting at the heartland of I think most innovation in the country, especially I think AI-driven innovation. If there was basically advice that each one of you had for entrepreneurs on how do you basically think about things when they come to you, what do they basically I think come to you with, how should or not, right? I think those are things that would be helpful for the audience to sort of really and go through for sure.
I'll give a start. Relative to AI and emerging technologies from a clinical side, I look at three areas. One was touched on around burden reduction and how we improve the clinician experience. Another one was also discussed around the quality of our data, how we take the data to make better decisions. We heard earlier about including precision genomics in decision-making around medication choice. The one that I haven't seen as much interested in that is, from my perspective, is AI agents delivered to our patients. And I think, and again, I mentioned patient empowerment. If you go into your AI of choice, ChatGPT, Gemini, whatever you like to use, and you put in, I have these health conditions, and my doctor suggests I change my behaviors around eating, around medications I take, exercise, any of those things, you can get a very nice summary of, oh, you know what, you want to lose weight and control your cholesterol, here's some dietary suggestions. But we know that only 10 or 20% of health is related to health care. Right. And a good third of it is related to your genetics. And unless you picked your parents really well, you can't do much about that. But half of it is about behavior. And we have been, as clinicians, complete failures at changing people's behavior. We say, go lose weight. We say, go eat, here's a page, eat based off this diet. And no one does it. If we could have an agent that actually could incorporate your preferences, your social drivers of health, your opportunities where you live and what you have access to, and your clinical data to create a behavioral health plan that you actually buy into because you help create it and it's all your personal preferences. I think we can do more with an agent in that space than anything we can do other than reducing burden for clinicians, because that is always my first thought. But I think on the patient side, I think it's an untapped area.
Makes sense.